Welcome. I'm Dr. Katrina Mark. I'm an associate professor in the Department of Obstetrics and Gynecology at the University of Maryland School of Medicine. My clinical and research work focused on the intersection of addiction and women's health. In today's mini video, we're going to be talking about alcohol use in women. Nearly 80% of all females over the age of 12 have consumed alcohol in their lifetimes. Rates of alcohol use and binge drinking have been increasing in women over the past decade, with rates of parenting women reaching those of men during the COVID-19 pandemic. Rates of alcohol use are also increasing in girls, with adolescent girls now being more likely to report past month use and binge drinking than adolescent boys. Definitions of different levels of alcohol use differ between men and women. Binge drinking for women is defined as 4 drinks in approximately 2 hours. About a quarter of women who drink report that they have engaged in binge drinking within the past month. Binge drinking is particularly prevalent in the 18 to 25-year-old age group. In 2023, the prevalence of binge drinking in this age group was 31.6%, which surpassed that of men of the same age. Heavy drinking is defined as more than 8 drinks in a single setting in women. In the National Survey on Drug Use and Health, about 5% of women reported engaging in heavy drinking in the past month. Heavy drinking carries with it higher health risks and a 70 times higher likelihood of alcohol-related emergency room visits compared to those who do not binge drink. There's no specific difference in the definition of alcohol use disorder between men and women, and 8.7% of women in the United States meet the criteria for an alcohol use disorder. The same amount of alcohol consumption tends to result in higher blood alcohol content in women compared to men. This is due to differences in body weight and composition, as well as different levels of alcohol dehydrogenase, or ADH, leading to differences in metabolism. Due to this, the dietary guidelines recommend that women consume 1 alcoholic beverage or less per day, while the recommendation in men is 2 or less. Of note, the recommendation is for complete abstinence from alcohol during pregnancy. Despite this, 8.4% of pregnant women are reported consuming alcohol in the past 30 days, and 5% reported binge drinking in the national survey. Women likely progress through the stages from first drink to alcohol use disorder in a different frequency, speed, and linear fashion than men. What some researchers refer to as telescoping, the idea that women progress more rapidly to alcohol use disorder than men, may actually be related to when women present for diagnosis and treatment. Alcohol use disorder is likely underdiagnosed in women, given that it has historically been thought of as a predominantly male problem. Likely due to a combination of underdiagnosis, higher social stigma, and greater barriers to care, women seek treatment less frequently than men, and those who do seek treatment often have more severe alcohol use disorder. Women face a higher risk of health consequences than men from alcohol consumption. Alcohol-related deaths are increasing at a faster rate in women, with a nearly 35% increase between 2017 and 2021. Women have an increased risk of liver disease, even with lower amounts of alcohol consumption, and their liver disease is less likely to be reversible. Women also have an increased risk of breast cancer with alcohol consumption. There's a dose-dependent relationship with even women drinking less than 1 drink per day, having a statistically increased incidence of breast cancer. Women who drink 1 to 2 drinks per day have a 13% higher risk of being diagnosed with breast cancer. Other health risks include an increased risk of osteoporosis and mental health disorders associated with alcohol use. In addition, alcohol use in women during pregnancy is associated with additional risks of miscarriage and fetal alcohol syndrome. Women are less likely to be screened for alcohol consumption and risky alcohol use than are men. Women are less likely to seek treatment, likely due to multiple factors, including stigma, family responsibilities, and underdiagnosis due to symptoms that differ from those of men, and therefore are often not recognized. However, when women do access treatment, they have similar outcomes to men. It is also important to note that women seeking treatment for alcohol use disorder have high rates of trauma and co-occurring mental health disorders, which should be taken into consideration during their treatment. Women are not only undertreated, they're understudied, particularly women with alcohol use disorder who are pregnant or lactating. The majority of trials evaluating the efficacy of medications for alcohol use disorder and alcohol withdrawal include a very small proportion of women. Nonetheless, these medications should not be withheld from women, given the importance of treatment. Alcohol use disorder and unhealthy alcohol consumption are prevalent in women, yet women are understudied, underscreened, underdiagnosed, and undertreated. Medical providers should be educated on the signs of risky alcohol use in women, as well as the treatment options. Thank you for listening, and thank you for your interest in this topic.